Have you ever wondered what ADHD is and how it affects people? Well, you're not alone. It's a question that's crossed many minds, and today we're going to shed some light on it. ADHD, or Attention Deficit Hyperactivity Disorder, is a neurodevelopmental condition that affects millions of children and adults worldwide. It's a complex disorder that impacts a person's ability to focus, maintain attention, and control impulsive behaviors. Picture this. It's like trying to tune into a specific radio station, but your dial keeps jumping between frequencies. That's what people with ADHD often experience. They have difficulty staying on one frequency or task, and their attention keeps shifting. It's not a matter of willpower, it's how their brain is wired. ADHD isn't a flaw or a failing, it's simply a different way of processing the world. Now that we know what ADHD is, let's delve into its history. The history of ADHD is quite fascinating and dates back to the early 20th century. However, even before that, the first mention of ADHD-like symptoms is found in the medical literature written by Sir Alexander Crichton in 1798. He described it as an arrest of mental development, which is intriguingly similar to what we now understand as ADHD. Fast forward to the mid-19th century, the work of Dr. Heinrich Hoffmann in 1844 provided us with the first case studies that were, in essence, describing ADHD. He wrote about children who were persistently inattentive, fidgety, and always on the go. Sounds familiar, doesn't it? As we move further down the timeline, we come to the 1960s when the term minimal brain dysfunction came into play. This was the first attempt to clinically define the constellation of symptoms we now associate with ADHD. Despite its somewhat misleading name, it was a significant step forward in our understanding of this condition. The real turning point came in 1980 with the introduction of ADHD as a medical diagnosis in the DSM-3, the Diagnostic and Statistical Manual of Mental Disorders. This was a landmark moment as it recognized ADHD as a genuine neurological disorder, not just a set of challenging behaviors. This recognition has been instrumental in shaping the ways in which we approach treatment and support for individuals with ADHD today. From the first mention of ADHD-like symptoms in 1798 to its formal recognition as a medical condition in the DSM-3 in 1980, the journey of ADHD through history is a testament to the evolution of medical and scientific understanding. It's interesting to see how the understanding of ADHD has evolved over the years. It's a reminder that our knowledge is constantly growing and changing, and it's a testament to the power of scientific exploration and inquiry. As we continue to learn more about ADHD, we can only hope to improve the understanding, diagnosis, and treatment of this complex and fascinating condition. Now, you might be wondering, what causes ADHD and how can we recognize its symptoms? Well, the exact cause of ADHD remains a mystery, but research points towards a combination of genetic and environmental factors. It's believed that ADHD can run in families. If a parent or sibling has ADHD, there's a higher chance that another family member might have it too. There's also a body of evidence suggesting that exposure to certain environmental factors during pregnancy could increase the risk of a child developing ADHD. These factors include tobacco smoke, alcohol, or drug use. Certain complications during birth, such as premature delivery or low birth weight, might also contribute to the onset of ADHD. But what about the symptoms? How do we recognize ADHD? ADHD symptoms can be categorized into two main types: inattentiveness and hyperactivity impulsivity. Inattentiveness characterizes individuals who have difficulty focusing on one task, who make careless mistakes in schoolwork or other activities, or who seem not to listen when spoken to directly. They might have trouble organizing tasks, following instructions, or they tend to lose things necessary for tasks or activities. On the other hand, hyperactivity impulsivity is seen in those who seem to be in constant motion or who talk excessively. They may feel restless, often fidgeting with their hands or feet or squirming in their seats. Impulsivity may cause them to act without thinking, interrupt others, or have difficulty waiting for their turn. It's important to note that everyone can exhibit these behaviors at times. However, for someone with ADHD, these symptoms are more severe, occur more often, and interfere with or reduce the quality of their social, school, or work functioning. Recognizing these symptoms is the first step towards diagnosis and management. Understanding ADHD allows us to better support those living with this condition, enabling them to lead fulfilling lives. So let's continue to shed light on ADHD, dispelling misconceptions and promoting understanding. ADHD is more common than you might think, and diagnosing it isn't as simple as ticking off a checklist. It's a condition that affects millions of individuals worldwide, and its prevalence is on the rise. In fact, according to the World Health Organization, it's estimated that around 3 to 5% of children globally have ADHD. That's equivalent to roughly one child in every classroom. In adults, the prevalence is slightly lower but still significant, with around 2 to 5% of the global adult population diagnosed with ADHD. But here's where things get a bit tricky. Diagnosing ADHD is a process that requires a comprehensive approach. It's not just about spotting the common symptoms like inattention, hyperactivity, and impulsivity. These symptoms can be shared by a number of other conditions or even just be a part of a person's individual character traits. This is why a thorough evaluation is necessary to ensure an accurate diagnosis. Typically, this evaluation involves several key components. First, a detailed medical exam is conducted to rule out other possible causes of the symptoms. This can include anything from a physical examination to laboratory tests. Next, structured interviews and behavior rating scales are used. These tools are designed to gather information about the individual's behavior in different settings. For instance, how does the person behave at work, school, or home? This information is then compared to a set of criteria for ADHD. In addition, it's important to note that the symptoms must be present in more than one setting, and they must interfere with the individual's daily life, and crucially, the symptoms must have been present since childhood. Lastly, a professional, such as a psychologist or psychiatrist, will review the information gathered during the evaluation process. They'll take into account the person's medical history, the severity of the symptoms, and how they impact daily life. Only then can a diagnosis be made. A correct diagnosis is crucial for managing ADHD effectively. It's the first step towards understanding the condition and finding the right strategies and treatments to manage it. Remember, ADHD is not a one-size-fits-all condition, and neither is its diagnosis. Each person's experience with ADHD is unique, and so is their path to diagnosis and management. How does ADHD affect everyday life, and what strategies can help manage it? Attention Deficit Hyperactivity Disorder, or ADHD, can significantly impact an individual's daily life. It can affect their social skills, emotions, and overall functioning. Individuals with ADHD may find it challenging to maintain focus on tasks, which can lead to difficulties at work or in school. They may also struggle with impulsivity, leading to hasty decisions that can have adverse consequences. Socially, ADHD can create barriers as well. Difficulty with focus and impulsivity can lead to misunderstandings and strained relationships. Emotionally, ADHD can be a roller coaster, with individuals experiencing intense emotions that may seem to come out of nowhere. So, how does one manage these challenges? Well, there are several treatment strategies available. Let's start with medication. Stimulant medications are often the first line of treatment for ADHD. These medications help increase attention and decrease impulsivity and hyperactivity. Non-stimulant medications are also an option and can be particularly helpful for managing ADHD-related mood symptoms. Therapy, particularly cognitive behavioral therapy, can be beneficial for individuals with ADHD. This type of therapy helps individuals develop strategies to manage symptoms, improve focus, and handle emotional challenges. Behavioral interventions can also be helpful, especially for children and teens, teaching them how to manage their behavior in different social situations. Lifestyle modifications can also be a crucial part of managing ADHD. Regular physical activity, a healthy diet, sufficient sleep, and limiting screen time can all have a positive impact on ADHD symptoms. Mindfulness practices such as meditation or yoga can also help manage symptoms by improving focus and reducing stress. ADHD is a lifelong condition, but it doesn't have to be a life sentence. With the right combination of treatment strategies, individuals with ADHD can manage their symptoms and lead productive, fulfilling lives. They can excel in their careers, build strong relationships, and make meaningful contributions to their communities. With the right help and support, people with ADHD can lead productive and fulfilling lives. Before we wrap up, here are some intriguing facts about ADHD. Did you know that this condition is more prevalent in males than females? Studies show that males are 3 times more likely to be diagnosed with ADHD. Also, it's interesting to note that ADHD often coexists with other conditions. Approximately half of individuals with ADHD also have a learning disability, while others may struggle with anxiety or depression. Moreover, some of the world's most creative minds were noted to have ADHD. Renowned personalities such as Albert Einstein, Thomas Edison, and even contemporary figures like Justin Timberlake and Michael Phelps were believed to have this condition. Their remarkable achievements demonstrate that those living with ADHD can lead rich, fulfilling lives. ADHD is a complex condition, but with awareness and understanding, we can help those affected navigate their journey more effectively.